Question 1. A patient with chronic heart failure is prescribed a beta blocker. Which of the following findings should the nurse assess for before administering the medication? A. Serum potassium level of 3.2 milliequivalent per liter. B. Heart rate of 58 beats per minute. C. Blood pressure of 150 over 92 millimeters of mercury. D. Serum creatinine of 1.5 milligrams per deciliter. Answer: B. Heart rate of 58 beats per minute. Rationale: beta blockers can exacerbate bradycardia, so the nurse should assess the heart rate before administration. A heart rate of 58 bpm is indicative of bradycardia, which could lead to further complications. The other options are not immediate contraindications for beta blocker use. Question 2. A patient is receiving opioid analgesics for postoperative pain. Which of the following complications should the nurse monitor for, considering the patient's history of chronic obstructive pulmonary disease, COPD? A. Respiratory depression. B. Tachycardia. C. Hyperglycemia. D. Increased appetite. Answer: A. Respiratory depression. Rationale: opioids can cause respiratory depression, which is particularly dangerous in patients with COPD due to their already compromised respiratory function. Tachycardia, hyperglycemia, and increased appetite are not common side effects of opioids in COPD patients. Question 3. A nurse is administering omeprazole to a patient with gastroesophageal reflux disease, GERD. The patient asks about the drug's action. What is the nurse's best response? A. It neutralizes stomach acid by binding to the proton pump. B. It inhibits the enzyme responsible for acid production in the stomach lining. C. It decreases the amount of gastric mucus secretion. D. It inhibits histamine receptors to reduce acid secretion. Answer: B. It inhibits the enzyme responsible for acid production in the stomach lining. Rationale: omeprazole is a proton pump inhibitor, PPI, that works by inhibiting the enzyme H+/K plus ATPase, which is responsible for the final step in acid production in the stomach. The other options describe mechanisms of different classes of drugs, e.g. antacids, H2 blockers. Question 4. A nurse is preparing to administer an anticoagulant to a patient with atrial fibrillation. Which laboratory result would require the nurse to withhold the medication? A. INR of 2.5. B. Platelet count of 80,000 per cubic millimeter. C. Serum sodium of 136 milliequivalent per liter. D. Hemoglobin of 12.0 gram per deciliter. Answer: B. Platelet count of 80,000 per cubic millimeter. Rationale: a low platelet count thrombocytopenia increases the risk of bleeding, making it unsafe to administer anticoagulants. INR of 2.5 is within therapeutic range, and the other values do not directly contraindicate anticoagulant therapy. Question 5. A patient is on warfarin therapy and starts a new prescription for amiodarone. Which of the following should the nurse monitor closely? A. Decreased serum albumin levels. B. Increased international normalized ratio, INR. C. Decreased white blood cell count. D. Elevated liver enzymes. Answer: B. Increased international normalized ratio, INR. Rationale: amiodarone inhibits warfarin metabolism, which can increase INR and the risk of bleeding. The other options are not direct consequences of the drug interaction between warfarin and amiodarone. Question 6. A nurse is educating a patient starting digoxin therapy. Which of the following symptoms should the nurse instruct the patient to report immediately as a sign of digoxin toxicity? A. Blurred vision and yellow halos around lights. B. Increased appetite and weight gain. C. Unexplained bruising and bleeding. D. Frequent urination and dizziness. Answer: A. Blurred vision and yellow halos around lights. Rationale: blurred vision and seeing yellow halos are classic signs of digoxin toxicity, which can lead to life-threatening arrhythmias. The other symptoms are not characteristic of digoxin toxicity. Question 7. A patient is receiving an intravenous IV infusion of phenytoin for seizure control. What is the nurse's priority action during the infusion? A. Monitor the patient for signs of respiratory depression. B. Ensure that the IV site is patent and the infusion is running at the prescribed rate. C. Assess the patient's blood pressure every 15 minutes. D. Administer an antiemetic for nausea before starting the infusion. Answer: B. Ensure that the IV site is patent and the infusion is running at the prescribed rate. Rationale: phenytoin should be administered via IV at the prescribed rate to prevent tissue damage or phenytoin-related hypotension. Respiratory depression is not a common effect, and blood pressure monitoring or antiemetic use are not primary concerns for this drug. Question 8. A nurse is administering an intravenous dose of amlodipine for hypertensive crisis. What is the expected pharmacologic effect of amlodipine? A. Directly stimulates the beta-adrenergic receptors to increase heart rate. B. Inhibits calcium ion influx into the vascular smooth muscle, causing vasodilation. C. Increases sodium retention in the renal tubules to increase blood volume. D. Decreases sodium retention by blocking aldosterone. Answer: B. Inhibits calcium ion influx into the vascular smooth muscle, causing vasodilation. Rationale: amlodipine is a calcium channel blocker that inhibits calcium ion influx, leading to vasodilation and reduced blood pressure. The other options describe actions of different drug classes, e.g., beta blockers, diuretics, aldosterone antagonists. Question 9. A patient with a history of photosensitivity is prescribed ciprofloxacin for a urinary tract infection. What instruction should the nurse provide regarding this medication? A. You should avoid direct sunlight and use sunscreen when outdoors. B. You should limit your fluid intake to reduce the risk of kidney stones. C. You should take the medication with food to decrease gastrointestinal upset. D. You should take the medication at bedtime to minimize side effects. Answer: A. You should avoid direct sunlight and use sunscreen when outdoors. Rationale: ciprofloxacin can cause photosensitivity, so the nurse should instruct the patient to avoid sun exposure and use sunscreen. The other options are not relevant to the photosensitivity risk. Question 10. A nurse is educating a diabetic patient on insulin therapy. The patient asks about the purpose of long-acting insulin. What is the nurse's best response? A. It works quickly to control blood sugar spikes after meals. B. It provides a steady release of insulin over a 24-hour period to control blood sugar throughout the day and night. C. It helps prevent low blood sugar by storing glucose in the liver. D. It is used to treat diabetic ketoacidosis during crisis. Answer: B. It provides a steady release of insulin over a 24-hour period to control blood sugar throughout the day and night. Rationale: long-acting insulin, such as Glargine or Detamir, provides a basal level of insulin to control blood glucose throughout the day and night. The other options describe the action of short-acting or rapid-acting insulins. Question 11. A patient with a history of hypertension is prescribed enalapril. Which of the following should the nurse monitor closely when starting this medication? A. Blood glucose levels. B. Potassium levels. C. Serum calcium levels. D. Liver enzymes. Answer: B. Potassium levels. Rationale: enalapril, an ACE inhibitor, can cause hyperkalemia, elevated potassium levels, due to reduced aldosterone secretion. Blood glucose, calcium, and liver enzymes are not directly affected by enalapril. Question 12. A patient receiving corticosteroids for chronic inflammation develops sudden weight gain and moon face. What is the nurse's priority action? A. Increase the dosage of corticosteroids. B. Administer an antihistamine for allergic reaction. C. Assess the patient for other signs of Cushing's syndrome. D. Encourage the patient to maintain a high-calcium diet. Answer: C. Assess the patient for other signs of Cushing's syndrome. Rationale: sudden weight gain and moon face are common signs of Cushing's syndrome, a condition caused by prolonged corticosteroid use. The nurse should assess further for other symptoms, such as buffalo hump or hypertension. Question 13. A patient is prescribed an SSRI, selective serotonin reuptake inhibitor, for depression. Which of the following is an important consideration for the nurse when monitoring this patient? A. Monitoring for signs of serotonin syndrome. B. Monitoring for hyperkalemia. C. Assessing for signs of hypoglycemia. D. Monitoring for signs of agranulocytosis. Answer: A. Monitoring for signs of serotonin syndrome. Rationale: serotonin syndrome is a potential life-threatening condition that can occur with SSRIs and is characterized by agitation, confusion, fever, and tremors. Hyperkalemia, hypoglycemia, and agranulocytosis are not typically associated with SSRIs. Question 14. A nurse is preparing to administer oral warfarin to a patient. Which of the following should the nurse include in the patient education? A. You should avoid taking aspirin while on warfarin therapy. B. Warfarin should be taken with food to avoid stomach irritation. C. You can eat large amounts of green leafy vegetables while on warfarin. D. You should take warfarin with a multivitamin to improve absorption. Answer: A. You should avoid taking aspirin while on warfarin therapy. Rationale: warfarin is an anticoagulant, and taking aspirin with it can increase the risk of bleeding. Eating large amounts of green leafy vegetables can interfere with warfarin's effectiveness, as they contain vitamin K. Warfarin does not require food or multivitamins to improve absorption. Question 15. A nurse is caring for a patient receiving a dose of morphine. Which of the following is the nurse's priority assessment after administration? A. Respiratory rate. B. Blood pressure. C. Heart rate. D. Blood glucose. Answer: A. Respiratory rate. Rationale: opioid analgesics like morphine can cause respiratory depression, which is the most critical side effect. Monitoring the respiratory rate is the priority to ensure the patient is breathing adequately. The other options are important, but not as immediately dangerous as respiratory depression. Question 16. A patient receiving insulin therapy for type 1 diabetes presents with nausea, confusion, and diaphoresis. What is the nurse's first action? A. Administer insulin. B. Check the patient's blood glucose level. C. Increase the patient's fluid intake. D. Administer a dose of glucagon. Answer: B. Check the patient's blood glucose level. Rationale: the nurse should first check the blood glucose level to determine whether the patient is experiencing hypoglycemia or hyperglycemia. If hypoglycemia is confirmed, glucagon or fast-acting carbohydrates should be administered. Question 17. A nurse is preparing to administer an IV dose of potassium chloride to a patient. Which of the following actions should the nurse take to prevent complications? A. Administer the dose rapidly through a large bore vein. B. Dilute the potassium in a 100 milliliter solution and infuse slowly. C. Administer potassium chloride undiluted through a small vein. D. Administer potassium chloride with a diuretic to increase excretion. Answer: B. Dilute the potassium in a 100 milliliter solution and infuse slowly. Rationale: potassium chloride should always be diluted and infused slowly to prevent complications such as arrhythmias and irritation at the infusion site. Potassium should never be administered rapidly or undiluted. Question 18. A patient with diabetes is prescribed metformin. What is an important patient education point for the nurse to include? A. You should avoid alcohol while taking this medication. B. This medication will help you produce more insulin. C. You should monitor your blood sugar levels and adjust your diet accordingly. D. This medication should be taken on an empty stomach for better absorption. Answer: A. You should avoid alcohol while taking this medication. Rationale: metformin can cause lactic acidosis, which is more likely to occur with alcohol consumption. The other options are incorrect, as metformin works by improving insulin sensitivity, not insulin production, and it should be taken with food to reduce gastrointestinal side effects. Question 19. A nurse is educating a patient about the use of an inhaled corticosteroid for asthma management. What is the most important instruction to provide? A. You can stop using the inhaler once your asthma symptoms improve. B. Rinse your mouth after using the inhaler to prevent oral thrush. C. Use the inhaler only during an asthma attack. D. Inhaled corticosteroids are not effective for long-term asthma control. Answer: B. Rinse your mouth after using the inhaler to prevent oral thrush. Rationale: inhaled corticosteroids can cause oral thrush fungal infection, so it is important for patients to rinse their mouths after use. The medication should not be stopped suddenly, and it is used for long-term control, not just during an attack. Question 20. A nurse is administering an IV antibiotic to a patient with a severe infection. Which of the following is the nurse's priority action when administering the first dose? A. Administer the antibiotic at the prescribed rate and monitor for allergic reactions. B. Administer the antibiotic rapidly to achieve therapeutic levels quickly. C. Administer the antibiotic with food to reduce gastrointestinal upset. D. Administer the antibiotic and monitor the patient for electrolyte imbalances. Answer: A. Administer the antibiotic at the prescribed rate and monitor for allergic reactions. Rationale: the first dose of an IV antibiotic should be administered at the prescribed rate, and the nurse should monitor the patient closely for allergic reactions, which can be severe and life-threatening. Rapid administration and food intake are not indicated for IV antibiotics, and electrolyte monitoring is not the primary concern unless specified. Question 21. A nurse is caring for a patient who is receiving vancomycin intravenously. Which of the following is the nurse's priority assessment? A. Blood pressure. B. Renal function. C. Blood glucose. D. Electrolyte levels. Answer: B. Renal function. Rationale: vancomycin is nephrotoxic, so it is crucial to monitor renal function, creatinine levels, urine output, to prevent kidney damage. Blood pressure, glucose, and electrolytes are important, but not as directly related to vancomycin's adverse effects. Question 22. A patient taking lithium for bipolar disorder presents with tremors, confusion, and ataxia. What is the nurse's priority action? A. Administer an additional dose of lithium. B. Assess the patient's serum lithium level. C. Give the patient oral fluids to rehydrate. D. Increase the patient's potassium intake. Answer: B. Assess the patient's serum lithium level. Rationale: these symptoms are signs of lithium toxicity, which can occur even with therapeutic levels. The nurse should assess the serum lithium level immediately to determine if toxicity is present. Rehydration and potassium are not first-line interventions for lithium toxicity. Question 23. A nurse is preparing to administer furosemide Lasix to a patient with heart failure. What should the nurse monitor closely before giving the medication? A. Blood glucose levels. B. Serum sodium and potassium levels. C. Serum creatinine and blood urea nitrogen (BUN). D. Liver function tests. Answer: B. Serum sodium and potassium levels. Rationale: furosemide is a loop diuretic that can cause electrolyte imbalances, especially hypokalemia. The nurse should monitor sodium and potassium levels before administration. Creatinine and BUN are also important, but are not as directly affected by furosemide. Question 24. A nurse is caring for a patient who is prescribed rifampin for tuberculosis. Which of the following side effects should the nurse educate the patient about? A. Discoloration of urine and sweat. B. Increased sensitivity to sunlight. C. Unexplained bruising and bleeding. D. Hyperglycemia. Answer. A. Discoloration of urine and sweat. Rationale. Rifampin can cause urine, sweat, and tears to turn a red-orange color. The other side effects are not commonly associated with rifampin. Question 25. A nurse is teaching a patient who is prescribed clopidogrel for stroke prevention. Which of the following instructions is most important for the nurse to include? A. Take the medication with food to reduce stomach irritation. B. Avoid eating grapefruit while on this medication. C. Monitor for signs of bleeding, such as bruising or gum bleeding. D. You should stop the medication if you experience dizziness. Answer. C. Monitor for signs of bleeding, such as bruising or gum bleeding. Rationale. Clopidogrel is an antiplatelet medication, which increases the risk of bleeding. Patients should be instructed to monitor for signs of bleeding and report them immediately. The other options are not the most relevant to clopidogrel therapy. Question 26. A nurse is educating a patient about the use of albuterol for asthma. Which statement by the patient indicates a need for further teaching? A. I should use this medication when I feel short of breath. B. I can use this medication every 4 to 6 hours as needed. C. I will take 2 puffs before exercise to prevent an asthma attack. D. This medication should be used for daily control of my asthma. Answer. D. This medication should be used for daily control of my asthma. Rationale. Albuterol is a short-acting bronchodilator used for quick relief of acute asthma symptoms, not for daily control. Daily control requires long-acting medications, such as inhaled corticosteroids. Question 27. A nurse is caring for a patient on a nitroglycerin infusion for acute chest pain. What is the nurse's priority assessment? A. Blood pressure. B. Heart rate. C. Serum electrolytes. D. Oxygen saturation. Answer. A. Blood pressure. Rationale. Nitroglycerin dilates blood vessels and can cause hypotension, so the nurse must monitor blood pressure closely. Heart rate, electrolytes, and oxygen saturation are important, but are not the primary concerns with nitroglycerin infusion. Question 28. A patient is receiving levothyroxine for hypothyroidism. The nurse should monitor the patient for which of the following signs of overdosage? A. Bradycardia and weight gain. B. Tremors and palpitations. C. Hypotension and cold intolerance. D. Depression and fatigue. Answer. B. Tremors and palpitations. Rationale. Overdosage of levothyroxine can lead to hyperthyroid symptoms, including tremors, palpitations, and increased heart rate. The other options are associated with hypothyroidism or normal thyroid levels. Question 29. A nurse is administering warfarin to a patient. Which of the following foods should the patient be instructed to limit in their diet? A. Spinach. B. Oranges. C. Bananas. D. Apples. Answer. A. Spinach. Rationale. Spinach is high in vitamin K, which can interfere with the action of warfarin, a vitamin K antagonist. The other foods do not significantly affect warfarin therapy. Question 30. A nurse is caring for a patient who is receiving digoxin and notices a heart rate of 45 beats per minute. What is the nurse's priority action? A. Administer the next dose of digoxin. B. Withhold the next dose of digoxin and notify the healthcare provider. C. Increase the dose of digoxin. D. Assess the patient's potassium levels and continue with the next dose. Answer. B. Withhold the next dose of digoxin and notify the healthcare provider. Rationale. A heart rate of 45 beats per minute is a sign of bradycardia, which can be caused by digoxin toxicity. The next dose should be withheld, and the healthcare provider should be notified immediately. Increasing the dose or administering the next dose is contraindicated. Question 31. A patient on a combination of warfarin and amiodarone develops an INR of 6.5. What is the nurse's first action? A. Administer vitamin K and notify the healthcare provider. B. Increase the warfarin dose and recheck the INR in 24 hours. C. Decrease the amiodarone dose and continue monitoring the INR. D. Discontinue warfarin immediately and start heparin therapy. Answer. A. Administer vitamin K and notify the healthcare provider. Rationale. Amiodarone inhibits warfarin metabolism, increasing the risk of bleeding. An INR of 6.5 is above the therapeutic range, indicating a risk for bleeding, so vitamin K should be administered. Adjusting doses or starting heparin is not the correct first step for this interaction. Question 32. A patient is prescribed levothyroxine for hypothyroidism and develops chest pain and tachycardia. Which of the following should the nurse suspect? A. Acute myocardial infarction. B. Hyperthyroidism due to excessive levothyroxine dosage. C. Respiratory failure from overdosage of thyroid hormones. D. Pneumonia from increased metabolic rate. Answer. B. Hyperthyroidism due to excessive levothyroxine dosage. Rationale. Excessive levothyroxine can cause symptoms of hyperthyroidism, such as chest pain and tachycardia. These symptoms are not typically seen with an MI, respiratory failure, or pneumonia in this context. The nurse should consider the possibility of overdose. Question 33. A nurse is caring for a patient on both atorvastatin and gemfibrozil. Which laboratory result should the nurse monitor closely for potential interaction? A. Serum calcium. B. Liver function tests, AST, ALT. C. Hemoglobin and hematocrit. D. Serum sodium. Answer. B. Liver function tests, AST, ALT. Rationale. Both atorvastatin and gemfibrozil can cause liver toxicity. The combination increases the risk of muscle-related side effects, e.g., rhabdomyolysis, so liver function tests should be monitored closely. Other options are not directly impacted by the drug interaction. Question 34. A patient is receiving an intravenous infusion of magnesium sulfate for preeclampsia. Which of the following is a sign of magnesium toxicity that the nurse should immediately report? A. Respiratory rate of 10 breaths per minute. B. Heart rate of 90 beats per minute. C. Deep tendon reflexes of +2. D. Urine output of 50 milliliters per hour. Answer. A. Respiratory rate of 10 breaths per minute. Rationale. Magnesium sulfate toxicity can lead to respiratory depression. A respiratory rate of 10 is significantly low and should be reported immediately. The other signs are less critical in the context of magnesium toxicity. Question 35. A nurse is caring for a patient receiving ciprofloxacin and warfarin. Which of the following should the nurse monitor most closely? A. INR levels. B. Serum potassium levels. C. Hemoglobin and hematocrit. D. Blood glucose levels. Answer. A. INR levels. Rationale. Ciprofloxacin can enhance the anticoagulant effect of warfarin, increasing the risk of bleeding. The nurse should monitor INR levels closely to avoid bleeding complications. The other lab values are not directly impacted by this drug interaction. Question 36. A nurse is administering a dose of heparin to a patient with deep vein thrombosis. The patient's activated partial thromboplastin time, APTT, is 70 seconds. What is the nurse's next action? A. Increase the heparin dose. B. Decrease the heparin dose. C. Continue the current dose of heparin. D. Hold the heparin and notify the healthcare provider. Answer: C. Continue the current dose of heparin. Rationale: the therapeutic range for APTT when on heparin therapy is typically 1.5 to 2.5 times the normal value. A value of 70 seconds is within the appropriate therapeutic range for heparin therapy. Adjusting the dose is unnecessary. Question 37. A patient on morphine for severe pain reports symptoms of urinary retention and difficulty voiding. Which is the nurse's priority action? A. Increase the dose of morphine to manage pain. B. Administer a diuretic to stimulate urination. C. Notify the healthcare provider for potential catheterization. D. Encourage the patient to increase fluid intake. Answer: C. Notify the healthcare provider for potential catheterization. Rationale: opioids like morphine can cause urinary retention due to their anticholinergic effects. The nurse should notify the healthcare provider to assess the need for catheterization. Increasing the dose of morphine or administering a diuretic is not appropriate in this situation. Question 38. A patient taking antihypertensive medication reports dizziness when standing up. What is the nurse's priority assessment? A. Measure the patient's blood pressure in both supine and standing positions. B. Ask the patient about dietary salt intake. C. Assess the patient for signs of dehydration. D. Check the patient's pulse rate. Answer: A. Measure the patient's blood pressure in both supine and standing positions. Rationale: dizziness upon standing could indicate orthostatic hypotension, a potential side effect of antihypertensive medications. The nurse should measure blood pressure in both supine and standing positions to assess for this condition. The other assessments are important, but secondary in this case. Question 39. A nurse is caring for a patient on concurrent therapy with digoxin and diuretics for heart failure. Which electrolyte imbalance should the nurse monitor for closely? A. Hyperkalemia. B. Hypercalcemia. C. Hypokalemia. D. Hypernatremia. Answer: C. Hypokalemia. Rationale: diuretics, especially loop and thiazide diuretics, can cause hypokalemia, which increases the risk of digoxin toxicity. The nurse should closely monitor potassium levels to prevent complications. Question 40. A patient is prescribed fluoxetine for depression and has a history of taking St. John's wort. Which of the following actions should the nurse take? A. Continue the fluoxetine as prescribed, as St. John's wort does not interact with SSRIs. B. Discontinue St. John's wort and monitor for signs of serotonin syndrome. C. Increase the fluoxetine dose to compensate for St. John's wort. D. Encourage the patient to increase the dosage of St. John's wort. Answer: B. Discontinue St. John's wort and monitor for signs of serotonin syndrome. Rationale: St. John's wort can interact with SSRIs like fluoxetine, leading to an increased risk of serotonin syndrome, a potentially life-threatening condition. The nurse should instruct the patient to discontinue St. John's wort and monitor for symptoms of serotonin syndrome, such as agitation, fever, and tremors. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.